Hi, everybody. So I have a new patient evaluation this morning. It is somebody with an acute ankle dislocation with multiple fractures. He's probably going to be having surgery next week, probably meaning definitely. But what's the reason for me going over there right now? First of all, it's to make sure that he's safe in his home with his crutches, getting around safely and effectively, being able to transfer from, a chair to doing the stairs to getting in and out of the shower, and then making sure that between him and his partner, they are, safe doing those types of things. But also to check, pulses, to look at his sensation. And then educate him that there are definitely some things that he can be doing to make sure that he preserves all of his other body parts. So things like making sure he has enough vitamin D, calcium, magnesium in his diet, and if not, supplementing because of the bone injury. Making sure that swelling isn't getting out of control. Making sure that he also can and should do some other exercises to keep his cardiorespiratory fitness up. So little upper body bike that sits on the tabletop, just doing a little bit of that to get his heart rate up. And then also, doing a little bit of core exercise that won't bother the foot and ankle, doing a little bit of hip exercise that won't bother the foot and ankle. These are all things that patients can be doing to preserve the rest of their bone and muscle quality and cardiorespiratory fitness, because we know that he's going to be off his feet for quite a long time. And that deconditioning and that muscle wasting and bone loss potentially, it can happen and it can set in really quickly. And by doing all of these things proactively, that can really help him and assist him in the recovery process. So making sure that he's sleeping well and getting the stuff that he needs to sleep. So that's part of being a primary care physical therapist, is making sure that you are looking at a patient, not just from the site of injury, but from all of their potential risk factors and body parts and body systems to optimize and enhance all of those things.